Hey everybody, welcome to Pick Dr. Osborne's Brain. If you're new to the show, it's very simple. Type in your nutritional questions and I'll do as many questions as I can in the next hour and help you guys out. Beyond that, if you missed Tuesday's show, we do a live show every Tuesday on a crash course of nutritional relation. We talked this week about gluten causing malnutrition, vitamin and mineral deficiencies. So if you didn't check that out, it's a fantastic class, almost 2 hours long, packed with information. So if you're wondering about gluten, how it affects the gut, leaky gut, how it causes malnutrition, if you're curious at all to know about some of the medications that can mimic the same damage that gluten can cause, or if you just want to learn more about nutrition as a whole, make sure that you check out that show. And that, again, that you can restream that at any time. So we're going to dive into your questions today. Before we get going, just doing some quick housekeeping because my tech team's not in today, so I'm running this on my end. So just let me know if you can hear me. Testing 1, 2, 3, and if you can, we'll get started. I'll wait for some responses here. Testing 1, 2, 3. Again, if you can hear me, just chime in now in the chat before we dive in. I want to make sure I'm not talking to myself. Okay, looks like we're coming in loud and clear. Okay, good deal. Audience poll here. How many of you have been keeping up with the MAHA movement? It's really interesting what we're seeing happen. Last week, I believe it was the COVID shots were actually, if you were a healthy pregnant woman or a healthy child, then they've taken now the COVID shot off of the schedule and removed it because of the potential to cause heart disease. Now, I find that kind of interesting myself because we've been saying that for a very long time. And I'm just glad to see something's being done about it. I'd like to see more aggressive policies around that as well in the future. What do you guys think about that? I'd like to know your opinions on those. So let's dive into your questions now. So Melinda's asking, if COVID is a vascular illness, if acute COVID temporarily raises your blood pressure from normal to high, what's the best approach to reverse this? Well, I would argue that COVID is not really a vascular illness specifically. Now, it can cause cytokine storms leading to inflammation in the vascular tree, which can elevate blood pressure. And if you're trying to overcome, there's probably some of the best ways nutritionally to support your body through that would be to do things that help with the spike itself. So N-acetylcysteine would be probably one of the things that I would personally use, about 2,000 milligrams a day. I'd also use a proteolytic enzyme, something like matrozyme, which basically helps to reduce the potential for blood irregularities and thickening. So those two things would be things I would personally gravitate toward. Outside of that, you got to overcome the infection itself, and so there are a number of things that can be beneficial there: zinc, vitamin C, vitamin A, vitamin D in high doses, quercetin, all come to mind as kind of first line therapies to get your nutrition to your immune system so that you have the best possible response that you can. Let's see. Yeah, I don't know what somebody's asking, what are the purple crowns? And I have no idea what the purple crowns are. It's maybe something YouTube has recently launched. Is it okay to heat one's meals up in a microwave? It's better not to. Certainly the microwave alters denatures many of the proteins in the food itself through the mechanism by which it heats. So one of the things I've always been partial to is I have a small ceramic heater in my office on the floor, and when I'm going to heat my food up, I put my Tupperware, I use a glass Tupperware in front of the ceramic heater, and I let that hot air just blow on my food itself, and I let that happen for a good 20 to 30 minutes, and that's how I heat up my food personally, versus using that microwave. What's the exact dose for niacin daily? Depends. It depends on what you're trying to accomplish with it, Shadi. Anywhere from 1 to 500 milligrams a day of niacin. If you're trying to induce a niacin flush, for say a detoxification program, if you're deficient in vitamin B3 specifically, 100 milligrams a day, or even in some cases less, 50 milligrams a day, it can be enough to correct the deficit. So it just depends on the context and how you're asking that question. Let's see. I'm 46 and have a variant of Lynch syndrome. Runs on my dad's side. They want to screen with a colonoscopy, but I'm hesitant of that procedure. Any alternatives? Well, there's not a direct alternative to colonoscopy because nothing else is going to visualize your colon. But if you're looking for alternative tests that can detect can depict potential problems of inflammation or not vascular, but colonic damage, yeah, there's a lot of options. There's calprotectin and lactoferrin, which are chemical tests that can be measured in the stool to determine whether or not you might have inflammation in your colon. There's also occult blood and you can measure white blood cell, red blood cell analysis of the stool specimens. You can measure the microbiome directly through stool specimens that might give you some insight into the health of your colon as a whole. So those are all things that you can do to get information about your colon, but nothing is going to replace the actual visual. Now you can do other imaging like ultrasounds, and some people go as far as even as aggressive as like a CAT scan. But if you're going to go in that route, those are very radiative. Not ultrasound, but CAT scans are very radiative. It's equivalent of about 2,000 X-rays worth of radiation. So you have to make that decision based on what you're most comfortable with. Have you heard in some countries they're prescribing olive leaf extract for upper respiratory issues? Yeah, we use a lot of olive leaf extract in our office for a number of different types of problems. But yeah, I mean, I think, well, not that Europe is perfect either, but I think in that regard, definitely moved in the right direction. Another functional doctor recommended taking vitamin C at bedtime. Based on some studies, do you advise limiting vitamin C to bedtime? No. I think you can take vitamin C at any time. I think you have to understand the mechanisms of vitamin C. If you take, so part of it depends on quantity. If you take a mega dose at bedtime, like 5+ grams, you might wake up with diarrhea in the middle of the night, or you might wake up with loose bowels. But it largely depends on the dose. Anytime you go over 1,000 milligrams of vitamin C, you depending on how sensitive you are to it, you can create gas or the potential for gas and bloating, and even potentially loose bowels. So timing at night, you want to consider that. I don't know, if that other doctor you were watching mentioned any kind of dosing structure, but say if you're gonna limit your vitamin C use tonight, one, you're limiting yourself in terms of overall quantity, because if you take a 5 or 10 gram bolus dose at night, it's just you're gonna probably wake up with bowel movements, and that's going to disrupt your sleep. So I outside of that, I can't really comment on what they were thinking or why they were making that recommendation. But in my opinion, vitamin C is best dosed throughout the course of your day, spaced into divided doses. In this way, you can take a much higher amount, but also it's better absorbed. When you get over 1,000 milligrams of vitamin C in a dose, the absorption rate drops to about 50%. So, if you take a 5-gram bolus dose at once, you're only going to absorb about 2.5 grams of that. But if you split that 5 grams over the course of your day, your absorption rate is going to be somewhere in the 80-90% range. So you'll get more bang for your buck. I need help with my grandson. We stopped gluten and even gluten-free thanks to you. He's doing better, but I suspect he has metal and mold toxins and malabsorption. Also, high histamine, hardly sleeps. Call my office. If you want help directly from me, call and get an appointment, Tanya. Outside of that, I mean, if he's got all those different problems, there's a variety of different potential possibilities. Those symptoms are not unique to one or two things. There could be a lot of potentials going on there. Certainly, if he's hardly sleeping, and remember, histamine is a bioactive chemical that keeps the brain alert and that keeps the brain awake. That maybe if he's got high histamines, that may be why he's having that issue. So, but the question mark is why, and that should be investigated. As far as fixing malabsorption, you have to assess the gut, and you have to understand if there is malabsorption, why, what's causing or driving that malabsorption. And, for some people, gluten definitely can be part of it, but there are many other foods that can drive gut damage. There are microbes that can drive gut damage. There are chemical exposures that can drive gut damage. There are medications that can drive gut damage. So all these things are going to be important in the context of what should be analyzed and looked at. I've been diagnosed with a cataract. Is there any supplement to keep it at bay? Yes, quite a few actually. We have a formula, Claire, called Focus, Focus. That formula contains several key antioxidants and nutrients that have been shown in human studies even to help to reduce the progression of a cataract. So that is something that you would want to consider. I can drop a link in the feed for you if you'd like me to, and you can read more about that particular supplement. But that's, if I were diagnosed with that, that's what I would use. I'm going to put that in for you here. Okay. Last blood work showed low in folate. Get folate and homocysteine test tomorrow. Anything I should avoid to get an accurate number? Not really. I mean, if you're supplementing with folate, you're going to get a potentially artificially elevated number. So, I mean, if you avoid, and if you're going tomorrow, ideally you would be off of any kind of supplementation if you're doing a serum lab test for nutrients for at least 2 days before you get that serum lab test. I really don't recommend serum lab tests so much as I recommend intracellular testing. And that's just because it's a more accurate way to assess whether you have a deficiency. Folate in the bloodstream is just going to basically measure your last meal or whether you have taken supplements, and so it's just a much less accurate way to make that determination. So beyond not supplementing, there's not really anything else that's going to dramatically impair those two serum tests. I would just encourage you to understand that, again, when you're doing serum testing, you're not really getting a long-term window of your nutrition status, and so it can be misleading. You can get normal levels of folate in a person who has folate deficiency because serum only measures what's floating around in your blood and doesn't measure what's actually making it into the cell where folate does most of its biochemical work. What do you think of vitamin K2 with vitamin D? I think it's fine. If you're talking about specific dosing, 90 micrograms, okay, it's a reasonable amount with 4,000 units of vitamin D. I think you could certainly take those things. Are you being tested? To me, testing is the is where it's at. If you know how much, if you know that you're low or you know your cells need more, that's where you want to really come in with more therapeutic doses. But 4,000 units of vitamin D is a pretty low dose by all intents and purposes. It's not a mega dose at all, even though a lot of doctors think it is. Most medical doctors I've ever seen write prescriptions for vitamin D are typically recommending between 1 and 2,000 units. We regularly start people at 8 to 10,000 units a day to get their levels corrected. What's an alternative to a CT scan of the chest? I have a protrusion on the sternum. I have a CT scheduled. A protrusion, is it a soft protrusion? Is it a hard protrusion? Is it a trauma? Was there any kind of car accident or seatbelt injury or any other kind of trauma that you sustained that led to the protrusion on your sternum? Or do you just have a protrusion on your sternum that's been there for a long time and you've asked a doctor to help you understand what it is? So the context there is very important, Allison. A lot of people have, like at the base of the sternum, there's a process here called a xiphoid process. And it's just basically it's a cartilaginous extension of the sternum. And some people genetically have a protuberance there, which is normal for them. And so I don't know what the context around your protrusion is, but I've seen doctors sometimes get scared about very natural xiphoid process protrusions that are just part of your anatomy and they're not necessarily a problem. As far as other alternatives to a CT scan, depends on what they're looking for. I mean, if like I said, if it's an extension of bone, an X-ray might be a good place to start. It's a much lower dose of radiation. An MRI might, if they're suspecting a soft tissue lesion, might be another way to go about looking at it as well. So, I mean, I would just talk to your doctor about those other alternatives and just let them know that you maybe are concerned a little bit about, using too much radiation. Let's see, what will help my brother with his joint pain and a stroke? I have celiac disease and I believe he is gluten sensitive. Yeah, he needs to give him a copy of my book, No Grain, No Pain. Because if you're celiac, the likelihood that he's celiac or gluten sensitive is extremely high. I mean, we already know that from multiple research studies, and I've seen that in family after family. When one person is gluten sensitive or celiac, the other family members are struggling in their health, and maybe not even in the way of a celiac diagnosis, but joint pain is an example of how gluten can cause harm. Vascular disease, such as stroke, is an example of how gluten can cause harm. So I'd start with giving him a copy of my book. Is he open to diet change? Because that's the other thing. Look, with family members, it can be tough. I have my family that I grew up with, my brothers and sisters and parents. And really, I think my oldest sister is gluten-free, but pretty much everyone else in my family is not. And many of them struggle. A lot of them struggle with either chronic pain or inflammation of some sort, or of neurological inflammation problems. So, as much as I am who I am in this world, and the message that I've been preaching for almost a quarter of a century, I can't even convince family members sometimes of the need to go gluten-free. And so that's the other thing to consider when it comes to families. You have every intention of trying to help them, but if they're not willing to accept the help that you're willing to offer, then don't own that too much. But I'd start with giving them a copy of my book, No Grain, No Pain, especially with the joint pain, where there's a lot of emphasis on that. You might also send them some of my videos on joint pain and gluten. We've got several thousand videos that you can forward to a family member, to a friend. I've spent the last decade creating an arsenal, a library of knowledge, freely to give to the world, so that people could come find the information and get help. So take advantage of our YouTube library. If you're not familiar, just go to my YouTube channel, and you can do a search directly on my YouTube channel for any topic that you're looking for if you want to send a family member information. How do I know if EBV is reactivated? I would say don't worry about EBV. EBV is never the problem. Treating EBV isn't the answer to chronic illness. I know there's some internet gurus out there talking about, yeah, it's EBV. No, it isn't. EBV is a consequence of poor functioning immunity. And if you understand what's causing the poor functioning immunity, then your immune system, you can make the necessary changes to give your immune system the strength it needs to put EBV into remission without necessarily having to treat it. But you have to figure that part out first. For most people, it's categorical. There's 4 categories of things that will overwhelm the immune system and allow for EBV virus titers to go up. One is food, just what you're eating, plain and simple. Number 2 is chemical exposure, and sometimes the chemicals are in your food, and sometimes they're in your environment, in the air that you breathe, or in the water that you bathe in, etc. The third category is microbes. There are certainly microbes that can colonize your GI tract and create and wreak havoc and give the immune system more pressure. Many of those, most commonly, are gram-negative bacteria, along with most well-studied gram-negative bacteria, along with candida and other types of yeast that can overgrow in the GI tract. And then the fourth is nutritional deficit. Your immune system can't fight viral epitopes or other infectious aspects of virus without zinc, without vitamin D, without vitamin C, without vitamin E, without vitamin A. Like, super critical that your immune system has nutrients to do the work of century work of maintaining health in your body through through its mechanisms. Nutrients are necessary to do that. I'm 85, been taking benfotiamine for 1.5 years to help repair. That looks like a typo to me. I'm not sure what you mean there, but to help repair something due to arthritis in your neck. The pain is finally gone. Do you recommend a maintenance dosage? You can. It's very safe. I mean, vitamin B1, very safe to take even long term. I'd say if you're on a maintenance dose of 150 milligrams a day, you'd probably be okay. But as with anything, if you've got a good doctor you're working with, that would be something that I would encourage you to ask them as well. Is there any way to test for food intolerances via serum, or is it simply symptoms? No, there's definitely. We used to run one online. We used to have one available for folks that were trying to figure out how to navigate other food beyond gluten. We've got a lab sabbatical going on right now, but we will have it back shortly. So be patient with us, and you'll see that announcement coming. Are vitamin D and vitamin A synergistic? Mainly, vitamin A and vitamin D work together on many of the nuclear receptors inside of your cell. So the nucleus inside your cell has a membrane, just like the outer part of the cell has a membrane. The nucleus has a membrane, and you have these little receptors sticking off. And many of these receptors are co-activated by vitamin D and by vitamin A. So in that way, they're synergistically helping to communicate messages to the genetic code to upregulate whatever it is that your body needs. And this is a classic example of this would be in upregulating thyroid hormone metabolism function. So what happens is you've got vitamin D, vitamin A, and thyroid hormone T3 that all stimulate this nuclear receptor that upregulate your metabolism. So they're all working together for that goal. Let's see here. Alternative to cholesterol medications for 300 total. I don't recommend trying to lower cholesterol, Derringer. I would say if you haven't watched my video on the cholesterol myth, that would be a good place to start to understand more about the myth of cholesterol lowering. Like the data is really clear at this point. There's 2 types of data that we have. We have some really big studies that have been done in the last several years showing that people attempting to lower their cholesterol over the long haul don't really have less stroke or heart attack. So there's that, right? And those drugs, those statins, don't come without consequence. We know they cause CoQ10 deficiency, and can contribute to cardiomyopathies, congestive heart failure. We know that they can lead to myopathy, muscle pain, and nerve damage. So, I mean, it's a cost aspect, not just a financial cost, but a cost on your health. It's a tax that you pay. Anytime you take medicine for a long-term solution to health, you pay a tax. You pay a side effect tax, which is usually nutritionally related, and that nutritional deficiency caused by that drug is usually this causes a similar disease state that you're trying to prevent. So the taxes, in my opinion, is you're treating yourself, but not getting anywhere. You're spinning your wheels. Now, is there an alternative? Why, again, going back to why would you want to lower your cholesterol? When I started practice decades ago, 300 was normal. And it's only that we now have a normal cholesterol values being at 200 because we've had three panels convene over the last 25 years or so that have lowered cholesterol from 300 down to 200, in subsequent meetings. And if you analyze who worked on those panels, what kinds of doctors worked on those panels, it was always pharma shills. You had on one of the panels, it was, I think 9 out of the 13 doctors were directly on the payroll for Merck and Pfizer. And another one of those panels, 4 of the doctors, all 4 that were on that panel made that decision, were all in bed with Merck and Pfizer. So, I mean, to me, it's the proverbial fox guarding the henhouse. We have a trust issue. I mean, I think with the Maha movement, there may be a road back, but in medicine today, we have a massive trust issue because what we've had is 50 years of incorrect information, right? Take this medicine, prevent that disease. In reality, we don't have less disease, but we've spent $4 trillion a year on medicine. So it's been a losing endeavor overall, and people are waking up to that fact at this point. And so, what do you do when the very advice that the entire medical system is giving you hasn't been effective and hasn't worked? Usually find alternatives. Going back to your question about alternatives for rosuvastatin, I'd encourage you to watch my video, The Cholesterol Myth, before you even think about whether or not you even need to lower your cholesterol. My daughter's 24. She has acne problems on her face. She did your gluten intolerance test, and 3 out of 4 markers are positive. What vitamins do you recommend for her? I'd say to start, I mean, just generically, anyone who's gluten sensitive, there's five nutrients I would recommend just as a general kind of overall. Let's try to touch as many bases as we can without specific information. The first would be ultra nutrients. That's my multivitamin formula. The second would be vitamin D. We have 2 different versions of vitamin D, actually 3. We have 2 liquids, and we have a pill form if people prefer that. Outside of those 2, I recommend omega-3. Omega-3 is going to provide the essential omega-3 EPA and DHA that so many people with gluten issues lack. And then the next I would recommend would be a probiotic. We have something called Biotic Force in that regard, and that's because it contains the strains of bacteria that we know gluten can deplete or can affect. And then the 5th would be Gluten Shield, which is a digestive enzyme formula to keep with you at all times when you're going out, if you're eating, on the road or whatever it might be, if you're traveling or doing anything socially where you're eating what we call OPF, other people's food, to give yourself a layer of protection from gluten cross-contamination. Certainly don't go out and eat gluten, but Gluten Shield is designed to kind of help give you that layer of protection. It's not designed to eat gluten. It's designed to protect you from accidental cross-contamination exposure. So those 5 things would be where I would start as a general rule of thumb. Now, beyond that, ideally, if you can get her tested, that's better. And we do offer INA, intracellular nutrition analysis testing at Gluten-Free Society, where we measure 55 nutrients to determine whether or not people have those deficits. And that way they know specifically what they need to take. But if you don't have that data, start there with those 5. A family member was able to get rid of migraine headaches or migraine aura consuming regular cranberry juice. Have you heard of this? How would it work? I mean, one of the triggers for migraine can be infection. And a lot of times where that infection will reside is in the urinary tract. And what cranberry does is it can cleanse the urinary tract, and it's been used for many years as an alternative for UTIs for people. And it's possible that your family member may have had a microbial migraine or a microbial induced migraine. That's a potential possibility. Do you have a supplement to help with high cortisol? Yeah, we have a few. We have ultra adrenal support, and then we also have something called Adrenacalm, which they both work. They're just different. One's more of a glandular, the other's more of an herbal adaptogen that supports adrenal function. But both of them would be a viable option in that regard. Beyond that, remember that the 2 main foods that fuel your adrenal glands, which are the glands that produce cortisol. So that's vitamin C and vitamin B5. Very, very critical. People with high cortisol and tremendous stress really typically do very well at taking extra B5 and extra vitamin C in the course of their day to support their adrenal gland function. And then beyond those things, make sure you're figuring out why your cortisol is high, right? Cortisol elevates because of stress. Now, there's 3 types of stress: chemical, physical, and emotional stress. So the chemical stress would be the things that you put into your body or that your body's exposed to that are invisible to your naked eye, so you can't see them. So like you can't see whether or not you have a vitamin deficiency. You can measure it, but you can't see it when you're eating your food. Chemicals coming into the body through your food or other mechanisms, those are things that can drive elevations in cortisol. Over exercising, undersleeping, not getting adequate rest can drive up your cortisol. I mean, so there's a handful of things to be aware of, and you just want to make sure that supplements are great for the support, but you want to take the active behavioral mechanisms in place to overcome. Taking iodine after INA showed I was low. Recently started making L-Reuteri yogurt. I read that iodine is like an antibiotic and interferes with L-Reuteri. How should I take both separately? It's not that iodine is an antibiotic and it's going to wipe out your flora. If that were the case, anytime anyone ever took iodine, it would kill any kind of good microflora they have. So I wouldn't be that concerned by it, but you can take them separately if you're worried about, the iodine interfering with the L-Reuteri, and just take them a couple hours apart from one another. Does focus help with eye pressure? So going back to that eye formula I was discussing earlier, I've had a number of people tell me that it does. I mean, there's no data that I can present to you in research that says, yeah, these nutrients in that formula are designed to treat eye pressure issues. But antioxidants have a multifactorial effect, and the formula itself is very antioxidant driven. And so for a lot of people, their eye pressure is driven by blood pressure issues and other issues that are oxidative in nature. And so taking extra antioxidants to support that is not a bad idea. Okay, so back to the question about the sternal lump. It's not traumatic, and it's just a raised area and smooth and fairly hard. Is it raised at the very base of the sternum? Because if it is, you probably just have an exaggerated xiphoid, and it's not pathological. But again, hard for me to make that determination from just reading a few brief comments. Trying to choose fruits that don't spike my glucose. Is it better to have a higher, shorter spike or a lower, longer spike? It's indifferent. I would say, if you're trying to choose foods that don't spike your glucose, mm, use a glucometer if you can get a hold of one. Sometimes doctors will prescribe them for home use. You can also, there are a number of companies that offer them. You can also just go over to the drugstore and buy a finger prick, and just see what plays out. But I would argue this: look, you eat fruit. A lot of people avoid fruit. There's so much. I've seen commentary like, don't eat fruit because it raises your blood sugar. A raise in blood sugar is not necessarily the problem. The problem is when your blood sugar is being raised and staying prolongedly raised all the time. And then you don't have a way to get that blood sugar into your cells to convert it into energy. So your body instead converts it to triglycerides and stores it as fat. And then you become obese and diabetic. It's behavior choices over time. We're talking about glucose in and of itself. It's not evil. It's not bad. A lot of people that will tell you that, but it isn't. And I would say is that if you're eating fruit, like at the end of your meal, if you're eating fruit, the data is pretty clear. If you go for a short walk after that, you're going to bring your blood sugar back down really, really quickly. So if you're concerned about it, just consider adding some light walk after the consumption. And that way you don't have to avoid a whole entire food group or tremendous amounts of foods as a result of living in fear that it could elevate your blood sugar. Now, if you have a glucometer, there are cases where we'll see a particular food will really ramp up somebody's sugar for a really long time, consecutively, consistently. And so those things, that can be helpful to determine, maybe those aren't the best choices for you. But as a rule, a spike in blood sugar after eating fruit is pretty typical and pretty normal. Any alternative for CT for a lot of imaging questions today? Alternative for CT imaging related to increased tingling of the lower legs and tinnitus. No official diagnosis. MRI. If you're looking at nerves, you can see things on nerves that the nerves are, MRI can be very good. If you've got increased tingling of your lower legs, they need to rule out lumbar discopathy, which is basically a disc herniation in the low back that can put pressure on the nerves that feed your lower extremity. But, and then with tinnitus, that can be neurological as well. And I've seen that combination in conditions like multiple sclerosis. So, if they're trying to rule out MS-like lesions on your spine or spinal cord, an MRI would work sufficiently well over a CT scan to get that kind of data. So again, talk to your doctor about their differential diagnosis for you. What are they thinking? What is in their mind? Like there's probably 4 or 5 different things in their mind that's called a differential diagnosis that they're trying to rule out or rule in based on testing and examination. So if you understand what they're thinking, then that, I could give you a better context of an answer. But MRIs are great for identifying neurological lesions on the spinal cord that might lead to tingling in the lower extremities. And Lori, if you haven't read No Grain, No Pain, do so, because I've seen both tinnitus and neuropathy in the lower legs go away just with diet change. So that's just something else you want to think about. What you mentioned about the extension of the sternum, why I have pain in that area, I don't know. You got to give me more context, Oscar, as to what kind of pain, how long does it last, how intense is it, how would you describe it? There are conditions like costochondritis, where as the ribs are connecting into the sternum, you can get an inflammation between the interstitial spacing, or not the intercostal spacing. And that sometimes can lead to tenderness in that area. You could have a subluxation of the sternum. It could be just as simple as popping it back in place. It's hard to say for sure, but those are just ideas for you. Greetings from Europe. My gluten-free journey and healing started with your channel. Thank you so much. You're welcome. My question, in your experience, would going milk-free help rid cysts in the body? It depends on the kind of cyst and whether or not milk was contributing to them. For some, I've seen dairy. Dairy, depending on the type of dairy. So if you're in Europe, the question mark would be, what kind of dairy is it? Is it cow? Is it sheep? Is it goat? Most dairy in Europe is A1 dairy, and A1 dairy has a casein protein that can increase the risk of autoimmune development. Of course, some of the theories behind cysts, depending on which type of cyst you have, is that those can be autoimmune induced or in part associated with autoimmunity. So I would consider that, but ideally get tested. Get tested for dairy reactivity. If you good doctors in Europe, they can do IgG, IgG4, IgA, and IgM reactions against dairy to help you better determine whether or not cutting that out might be beneficial or helpful. But I'm a big proponent of testing and not guessing, because when it comes to diet change, food and culture, it's just so ingrained in us. And so many people are just so not willing to change their diet without objective data staring them in the face, knowing that it's the right thing to do. Do you need to pay attention to the arginine-lysine ratio when battling viruses? Possibly. I would say if you have a history where you really want to pay attention to that ratio, is if you have a history of like herpes simplex blisters or shingles. And if you have that, then you definitely want to go heavier on the side of lysine if you're trying to battle a virus. And you might consider even looking at your diet to see if you're eating mega arginine foods. Again, this is a caveat if you have a kind of a recurring fever blister, aphthous ulcer, or herpes blister outbreaks. That's where you want to pay more attention. But as far as like other viruses, not so much. What could be the cause of my bowel movements to smell like manure? Well, I mean, they are manure. If it's different from what I just assume that you mean that it's different from maybe what you have recognized your bowels to smell like historically. I don't know. Maybe you could comment better. But there are a lot of things that can affect the bowel odor, and sometimes it's digestive enzymes or a lack thereof, and sometimes it's a lack of the right kinds of bacteria living in your GI tract. Sometimes it's the presence of abnormal bacteria living in your GI tract. A lot of times we have people that have foul-smelling feces or stools. We find yeast overgrowths or Klebsiella or Pseudomonas types of bacteria growing, and those things can contribute to it. So you might consider getting some type of a stool testing analysis, chemical and microbial analysis on your stool to determine or to help to determine the potential reason. Thoughts on mushroom supplements? I mean, mushrooms can, depending on the kind of mushroom and what you're wanting to take them for, they can be helpful. But I'm more of a purist. I think most people focus too heavily on supplement solutions and not heavily enough on behavioral solutions. And that being said, mushrooms do have medicinal benefits, reishi and lion's mane among just as a couple of examples that can affect immune system function and cognitive function. So just really, if you have a specific type of mushroom you're interested in, that would maybe be easier to answer for you. I suffer iron deficiency for several years and diagnosed with semicircular canal problems and how monoglomal gammopathy. Not sure that maybe there's a language barrier there, so not sure of your question. Is there anything that can cause high cortisol besides stress? at the end of the day, it's all about stress. I mean, you can have a tumor on your adrenal glands, but that's pretty rare and probably not the issue. But I mean, define stress: physical, chemical, or emotional stress. Physical stressors generally are too much activity or not enough activity, or um, being subjected to not enough sleep, because physically that'll break you down. Emotional stressors, I mean, you can read between the lines. There's relationships, there's job stress, work stress, life stress, money stress, every stress in between that can be classified as emotional. And then there's chemical stress, micronutrients and infectious microorganisms, chemical exposures. So those are all big categories. I don't think beyond those categories that I've ever seen anything except for maybe, like I said, a tumor that's driving abnormal function of the adrenal glands. And then if you suspect that, you should get an image done and you should get a diagnosis. What would cause hair thinning on a keto diet? So the keto diet itself, depending on how aggressive your keto diet is, it's a restrictive diet. And there's a lot of people out there that say the body doesn't need carbs and carbs aren't essential. I would argue otherwise. I think we should strive for balance in our diet. And when we use restrictive diets, generally it's because we're ill and we're willing to take on the role of a restrictive diet to restore health. But the long-term consequence of being on a restrictive diet, none of that's been really adequately studied for any great length of time to say, hey, this is right for everyone. And that can manifest for many as stress. I see women, especially women, all the time when they go on a keto diet over longer periods of time, they start to develop hormonal disruption, hormonal imbalance, as well as hair thinning. And when we add some carbohydrate back in, they do better. So, I mean, that's a potential possibility. I'm not saying it is your cause. You might also have created nutritional deficiencies in your diet that are, affecting your hair's ability to grow. Predominantly, things like biotin or zinc or vitamin E. Some of the amino acids are critical, and you can be eating high protein and still be amino acid deficient, especially if you have a history of gluten sensitivity, malnutrition, which is what I talked about in Tuesday's show, where even people going gluten-free, keto, have persistent issues that linger nutritionally because of the prior existing damage to their GI tracts. And so they're still malabsorbing to a large extent. Many times that requires supplementation to overcome. So testing might be a good element for you, Thomas, to look into. And for those of you that are looking at doing micronutrient testing through our website, through Gluten-Free Society, this weekend, you can use code TEST15 and when you check out and save 15%. So any of you that want to, give that a go and also take advantage of that discount, I'd encourage it. As a general thumb, I'm suffering from alopecia areata. You got to figure out why. That's an autoimmune disease, Solomon. And if you've got an autoimmune disease, you've got triggers. There's not a supplement that fixes triggers. You could take supplements for hair. You can take more protein to help your hair grow, potentially support hair growth, but you're not going to fix the autoimmune destruction of your hair follicles, which is what alopecia areata is. So what are the triggers? Food, chemical exposures, microbial imbalance, and nutritional deficiencies. Get those things, get a good doctor who understands those things, and get those things tested. Would be my advice, not to just pump your body full of supplements, because that won't fix autoimmunity. If B1 won't reverse tachycardia, what else might help? Magnesium. A lot of times when people are taking B1, you need magnesium to activate B1. So sometimes B1 won't work because you don't have enough magnesium. So it's always a good idea with B1, if you're doing higher doses, especially, to maybe add some magnesium, 300 to 400, even up to 600 milligrams a day of magnesium into that mix if you're really trying to optimize that B1's ability to function. But that would be one. And then, tachycardia has a lot of other potential reasons or causes. if you're in a fight or flight situation chronically, that'll elevate your heart rate, because when your body perceives danger, it's going to produce more adrenaline and noradrenaline, which is going to elevate your heart rate. And so you'd have to get that under control. And so what are the triggers? Same as autoimmune disease. Food, chemicals, microbes, and nutritional deficiencies can all be triggers in that regard. You recommend statin if diabetic, high LDL. Do I recommend a statin if somebody's diabetic and they have a high LDL? No, I recommend changing your diet. LDL is not the culprit of heart disease. It's that old adage if any of you, when you were a kid and you were hanging out maybe with the wrong kind, and your parents said, quit hanging around with that person, you are who you hang out with. And I know maybe many of you can relate to that. LDL is like, is being accused of being one of those bad kids, but it's not a bad kid. LDL is an innocent bystander. LDL is your kid, right? It's the kid. And so what happens is LDL doesn't cause heart disease. Inflammation does. But when your body's chronically inflamed, LDL can deposit into the vascular artery lining, and it can create plaquing. But LDL isn't the reason the plaquing is occurring. It's a side effect of the inflammation. So if you control the inflammation, you don't have to worry about the cholesterol. So what causes inflammation? If you're diabetic, being diabetic, high glucose, high glycation. Glycation causes inflammation. And so you got to control your diet and become a non-diabetic. Type 2 diabetes is 100% reversible with diet and lifestyle. And if that's the first time you're hearing it, shame on your doctors. But diabetes is absolutely a disease of choice. Sometimes it's not that you're trying to make the wrong choice. It's sometimes just you've been educated incorrectly and you're making the wrong choice because you've had bad advice. But if you want to get diabetes under control, you've got to control your diet and your activity. And I have a crash course on that too. So I would encourage you to watch that. It's a crash course on controlling blood sugar. If I'm taking Gluten Shield, do I still need another digestive enzyme like Ultra Digest? No, it serves as a duality. So it's a comprehensive digestive enzyme formula. So you wouldn't need to add another one to that per se. If you're gluten intolerant but ingest some accidentally and get lucky and have no observable symptoms, is it possible that it didn't make it out of the gut to the bloodstream and that's why? Yeah, it is. It's possible. Humans aren't wimps and weaklings. We do have an immune system, and part of that immune system, a large part of it, is in your GI tract. And if you've been working hard at your diet and getting your gut healthy, there are a lot of people that get exposures or get out of accidental exposures and are asymptomatic because the health of their gut lining is strong and it isn't just wiping them out. So yes, that is a possibility. Processed sugar, I know it's evil. Will it hurt in general to have little on rare occasions, or should it be avoided all the time? I know that is best, but ask. Yeah, I mean, when people, this is not to say this, but when people are asking me for permission to eat sugar on occasion, it's a real slippery slope. That being said, I would venture to say probably everyone eats sugar on occasion. And that's even true of myself. It's very, very rare, but it does happen. I think in that context, where I would encourage anyone, well, first of all, I'd encourage anyone to endeavor not to as much as possible. And if you do get exposure to it, I would encourage as much as possible that it's organic, because otherwise you're getting a glyphosate bomb in your sugar. And so now you have two poisons instead of just one. But we also have to have care around how we define a rare occasion. To me, a rare occasion is once or twice a year, rare, right? To some people, a rare occasion is 5-10 times a month. So, I would say if you're talking about once or twice a year, if you had some, I don't think it'd be the end of your health. I think your body's more complex and more resilient than that, or I would hope that it would be. Supplements to repair recent posterior vitreous detachment, retinal hemorrhage with high blood pressure. Gosh, I mean, there's not a supplement that's going to fix those things. I mean, there are things that you can take that might support your body's ability to heal and repair from the damage. And in that regard, I would encourage you to read more about our surgery protocol. Maybe I can throw a link up for you. Let me search that for you. I've got our surgery protocol. For those of you who haven't seen it or don't know about it, it's a protocol. If you're going to have surgery or if you've had an extensive trauma, so it works in both cases. It's supportive in both cases. But when we gave it its name, we called it a surgery protocol. That being said, I'm going to put that link in the feed. But any of you that have had extensive trauma or are going in for surgery, go read this, go look at it. And those are the nutrients that we try to prioritize people getting into their body to help them heal and repair, after the fact. So that's what I would encourage you to look at. Anne is asking, my gluten sensitivity test showed HLA-DQ8 on all 4 alleles. Does that mean I am at a significant risk of developing celiac if I eat gluten? Well, the reality is it doesn't matter. Everybody's always worried about celiac disease, and I think the worry is in the wrong direction. I think if you have 4 gluten alleles, you shouldn't eat gluten. And whether or not you have a risk of developing celiac disease is irrelevant, because gluten can cause 140 different types of illnesses. And celiac is just one of them. But I mean, we see gluten neuropathy, we see gluten ataxia, we see gluten-induced arthritis, we see gluten-induced fatty liver issues. I mean, gluten can affect any organ, any tissue in your body. But everybody wants to focus on celiac disease as like gluten is it's the worst aspect of being gluten sensitive is if you develop celiac disease. It depends on your pain. Depends on you. I mean, would you rather have debilitating arthritis, or would you rather have chronic diarrhea from malabsorption and gut pain? Those are 2 bad questions. I don't want either one of those things. And if the solution is going on a gluten-free diet, then it just becomes academic as to whether or not you go on to develop or don't go on to develop celiac disease. Now, that being said, 99% of all celiacs have either HLA-DQ2 or HLA-DQ8 alleles. So technically, yeah, I mean, you're in that risk category for those reasons. But again, the emphasis really should, in my opinion, shouldn't be on celiac disease. It should be on gluten sensitivity as a whole. If you have protein with fruit, will it balance your sugar levels? It'll just probably slow down the digestion. It doesn't really balance your sugar levels, because you're eating just as much sugar whether you just ate the sugary fruit or whether you ate the sugary fruit with protein. But when you slow down the digestion of the meal, and the meal slow trickle, dispenses glucose more slowly to the bloodstream, then it's going to have kind of a prolonged effect as opposed to a potentially an acute large spike. But you're still getting just as much sugar, just as much glucose. Is keto the best diet for active cancer? Not necessarily. Different cancers have different personalities. So I think first and foremost, I mean, we could say keto diet is a good start, because the keto diet, you have to understand how most cancer cells generate energy through what's called the Warburg effect, which is they ferment sugar, and in an attempt to make their energy. So they use a fermentation process to generate energy versus oxidative phosphorylation, which is what humans use to make energy from glucose. So you can certainly not feed the cancer by giving it carbohydrate, and that's a good start. But there's nuance to that. And part of that just depends on whether approaches you're taking, and part of that depends on what's driving your cancer. Can sugars drive cancer? Absolutely, no doubt about it. But is that the main thing that's driving your cancer? As an example, I mean, I've seen cases of people allergic to fruit, allergic to vegetables, allergic to meats. So you could be consuming something else that's driving inflammation that's contributing to your cancer as well. And so then there's modifications that you'd want to potentially make in that regard. The keto is not a bad place to start for sure. What do you recommend for a fatty liver? Work with somebody who understands how to reverse it with diet and nutrition and lifestyle. But as far as supplementation is concerned, there are certain nutrients that we know when deficient can cause fatty liver. So you should look into inositol. You should look into choline as two very key nutrients that we know when low can cause fatty liver. A high carbohydrate diet can cause fatty liver. Gluten can cause fatty liver. Vitamin B12 deficiency can cause fatty liver. So all those things are going to be important in the context of you, but what's driving yours becomes the number one question that needs to be answered. I have a crash course on the liver that you might want to check out. There's probably a lot more context in that video that you would find helpful. How can I regain my sense of smell? I have a sinus issue. It's a tough one. Depends on why you have the sinus issues. Some people have sinus issues because they have colonization of their sinus cavities by microbes. So you could get a nasal culture to see if that's part of what's contributing. Some people are allergic to things in the environment. You can have, pollen and dander and other types of allergies that can drive mucus production in your sinuses and reduces your capacity to smell. You could have a zinc deficiency. So that's probably nutritionally, one of the more common reasons why people develop anosmia. But I would look at quercetin with zinc as a potential for a few months to see if that doesn't help you. I'd also look at N-acetylcysteine. If you have a chronic sinus issue, cysteine works to break up the mucus in your sinuses so that it'll help them drain better. You might also consider a neti pot. And at night when you go to bed, just drain your sinuses with the neti pot with a good saline solution. But all those can be very helpful. Can chronic lymphocytic leukemia be reversed? That's one of the cancers we know gluten can cause. I've seen cases recover over the years. Change with diet change. I've seen people do really, really well in that regard, but no doctor can predict the future of what your situation is. So the best thing I could tell you is get with a good doctor and work it out. Are you familiar with the scanner that scans carotenoid levels in the skin? I am, but I'm not crazy about it. It's a multi-level marketing scheme. And, carotenoids are one of many types of antioxidants. And certainly I wouldn't try to base a person's entire regimen of guidance on how much carotenoid levels are circulating in their skin based on a light scan. So hopefully that answers your question. Oh, so the question about the cyst, it's an ovarian cyst. I use lactose-free cow milk. Is this okay? I wouldn't be drinking milk with an ovarian cyst. That would be, in my opinion, a bad idea. A lot of the ovarian cysts are driven by a couple of different things. Number one, they're driven by excessive glucose. And, when you're using dairy, you're getting that over the lactose, which is one of the sugars in dairy. If you're doing lactose free, that maybe is a step in the right direction, but how processed is that milk? And then number two, if that dairy is driving inflammation, it's going to drive up your cortisol and insulin in the process, which is going to contribute to cyst formation of the ovaries. Also, depending on the cow and where the stress levels of the cows, cows have hormones in their milk. And one of the things about ovarian cysts, one of the things that are stimulatory about that is excessive androgen. So, how are those cows being treated where you're buying your milk? Are they under tremendous stress? Is there the potential that their milk is higher in androgen-based hormones that might be driving your cyst as well? These are all just questions that I would ask and to help you make a better decision about what's right for you. What do you think of dye when doing a CT scan? Can you request a lower dosage? Look, I can't tell you what to do, but I can tell you what I would do. There is no way in hell that I'm going to get injected with radioactive dye. Period. End of story. You can still do an image without radioactive dye. A lot of doctors will squawk about it's harder to visualize that area. And to get a more accurate, image, we really need to use the dye. And but if it's me making the call or making the decision, no, you're not using the dye. I'm not going to do dye. You're lucky if I'm going to allow even a CT scan. You just don't need the radiation. If the solution to diagnosing the illness causes harm, to me, we have to rethink how we're doing imaging. But I'm just one doctor with one opinion. Commuting to work, covering long distances makes me very tired. Suggest a remedy. Exercise in your car, wiggle. Do hula hoop motions with your hips when you're sitting and driving. Now, be safe when you're driving, but a lot of people get tired when they're going long distances in their vehicle because they're sitting, and that motion of the road going by can be mesmerizing, almost hypnotizing, and make people tired. So find stimulating music that you can listen to, maybe stimulating audiobook, something that keeps your mind active while you're driving to reduce fatigue. All those are potential, strategies. What do you think about moringa? Is it okay if you have Hashimoto? It's fine. I have a moringa tree. I like moringa. But I don't think it's a cure-all plant as it's being pushed out on the internet. But it does have, leaves of the moringa tree have great nutrient density and can be a good part of a plan. I like that. Linda says, thanks so much for the arnica gel tip. Helps so much. I'm thankful that I realized it's the DH after decades of damage. Me too. I'm glad it worked for you. Yeah, so Salman, if you don't have a functional medicine doctor near you and you're wheat, barley, and rye free, and you're still struggling, you got to get the oats out, you got to get the rice out, you need to get the corn out. Just because you're in India doesn't mean you can't stop eating rice. I mean, I'm German and I could stop drinking beer. So, I mean, you can do it. It's just a matter of the will to do it. Do you want your hair more than you want your rice? That's the question you need to really think hard on. At least that's my experience. When people have autoimmune disease, if they continue to eat grains, they continue to have autoimmune disease symptoms. That's just what I've experienced over my practice for years. So, I'd encourage you to think about that. If you haven't read No Grain, No Pain, I would also encourage that. Heard that B1 deficiency is common in mold patients. Have you heard this? Yeah, I've seen it. There's not a lot of research on what common deficiencies are present in mold patients. It's more anecdote and clinical observation, and we've seen that be the case. But I can tell you the number one deficiency that we see in mold patients, Lynn, isn't vitamin B1. That's not to say it can't be present. It's carnitine. Carnitine. It's basically it's a nutrient comprised of 2 amino acids, and it's the taxi cab or the shuttle for fat. It helps your body shuttle fat into the cell where it can be generated and turned into energy. Is butyrate good to heal the gut lining if you can't handle glutamine? I mean, it can be helpful. When we do our testing, we always test people's butyrate levels so that we have an understanding of whether or not they need more. And I've seen it, work really, really well for folks. But certainly, it's a relatively harmless thing to take. So I mean, it's worth a shot if you don't tolerate glutamine and you're just trying to give your gut better support. And then how do you fix pyroluria if you can't handle too much zinc or P5P? I'm sorry, too much B6 or P5P. I would take the minimum dose that you can tolerate. Even if it's just 2 milligrams a day of P5P. Don't take pyridoxine hydrochloride at all if you've got a history of B6 toxicity. But you might also consider if you've got pyroluria and it's driving it, you might consider looking at zinc, because zinc can be very, very helpful in that regard as well. And even better yet, you might look at a full array of measuring your nutrition, your nutrient levels, your overall nutrient levels, not just zinc and B6. How can you raise IgA levels? You got to eat enough protein. Glutamine can be helpful. Vitamin C can be helpful. And you have to eliminate the exposure that caused your IgA levels to drop in the first place. So if you have IgA deficiency, it's very common. IgA deficiency is commonly caused by gluten. It's because your body is producing IgA to deal with the gluten, and then over time that demand for more IgA, it gets capped, and when you become malnourished, you can't keep up with that demand, and your IgA levels start to drop. So diet change is a big important part of raising IgA levels, but you need protein, you need glutamine, you need zinc, you need vitamin C to make IgA as well. So those nutrients play a critical role. So those are all things that you just on the surface I would be wanting to know about. Have an appointment with a GI or the dermatologist and will probably be sent to a GI doctor, but will it even help me at all to go to the doctor? I don't know. I think going to the doctor depends on your philosophy. You have to make your own decision in that regard. But like myself, if I had a skin issue and if I had a gut issue, would I go to the doctor? No, because for me, it would be a total waste of my time, because I'm not going to take drugs and I'm not going to take immune suppressing treatments, and I'm not going to let them run a scope through me, and I'm not going to let them do the things that they use as tools to try to help people. And it's not their fault that those are their tools. We just have a difference in philosophy about how we think about health. I'm of the belief that medicines don't create health, that behavior changes and diet changes can. And we have to start there first. So Linda, you have to ask yourself, what's your philosophy? It's a waste of your time if your philosophy is such. But if it's not, and you feel like there's a value in getting a second and third opinion, then by all means go get one. Do you recommend statins with high LPA? No, because statins don't lower LPA. That's any doctor that tells you that take the statin to lower your LPA is full of it. They don't know what they're talking about. Statins do nothing for LPA. There's really only one thing I've ever seen lower LPA effectively, and that's mixing vitamin C with lysine at high doses. We've seen anywhere from 30 to 40 point drops in LPA in folks. And so there's no drug that lowers it, including statins. I have mild chronic gastritis and hiatal hernia. Any supplements that can help with gastritis? You got to change your diet, and spicy food is not always the cause of gastritis, although that's the generic recommendation that doctors give. Don't eat alcohol, don't drink alcohol, don't eat spicy food, don't smoke. And it's all good advice, but what causes gastritis? Gluten can cause gastritis. Other food sensitivities can cause gastritis. Helicobacter pylori, which is a bacterial infection of the stomach lining, that can cause gastritis. All those things have to be ruled out and measured, and that way you have an understanding of what you can actually do as far as just supplements to support you from a symptom perspective. We do have a product called GI Soothe, and that product is it's a mucilaginous that's its purpose is just to help coat, line the GI tract and soothe that lining. But it's not a treatment and it's not a cure, but you might find some benefit symptomatically in using it. But you ultimately need to figure out why the gastritis is there, because if you don't have an answer to that question, you just be dependent on whatever remedy. And I'm going to send you a link here so that you can read more about that. There you go. I've been on a gluten grain-free diet for 8 months. I was only asking for the knowledge. I've already had significant improvements in my health, so I'm not going back to eating gluten and grain. Awesome, Anna. Good job. Way to stick to it. Thank you, Dr. Osborne, for this live. I'm wondering what you would recommend for someone with stomach upset after eating undigested food seen in the stool. If it's undigested food in the stool with an upset stomach, you want to look at digestive enzymes. So looking at either like Ultra Digest, that's one of our support enzymes, or even Gluten Shield. Either one of those would be a good place to start to see if it's helpful. I am yes on everything on your genetic gluten sensitivity test. I don't feel bad when I eat gluten. Can you explain this? Yeah. One of the things that we know about gluten is that it can actually mask its own toxicity. The gluten itself, when you're digesting gluten, one of the byproducts of breaking down gluten protein is something called gluteomorphin. And gluteomorphin binds to morphine receptors, and it can inhibit the symptomatic responses a person might have. We see this quite a bit. That being the case, I don't know if you ever heard of silent celiac disease, Diana, but what happens to many people is they're completely asymptomatic for decades, and then they end up with a cancer diagnosis, or they end up with a major problem because the damage progresses, and now the symptoms are no longer being masked. So if you've tested severely positive, but you've also tested positive on your gut tests, for gluten, then I would strongly encourage you to not ignore those test results, despite the fact that you may not be super symptomatic at this point, because symptoms can creep and gluten can mask its own toxicity. So just be careful. How to treat glaucoma without surgery, eye drops, laser. Do you have a natural treatment? Not really. I mean, depends on the severity of the glaucoma. They're definitely, I've seen cases where people were getting ready to go to surgery, like they had it scheduled, they had it planned, and then they changed their diet, and we worked with them to change their food sensitivities, and we got them well nourished, and ultimately they didn't need the surgery. Now, I have seen that be the case, but I don't want to just give you a generic, do these 6 things and you'll not need any kind of surgery, because I can't, no doctor can predict the future, first of all, but I just share my experience with you. But I would look at diet change and nutrition support as if there's no urgency to get these treatments done, and start there first. And if you have benefit and you see improvement, then you have an answer. And if you don't, then you can always move forward, with the procedure if you need it. Not easy cutting out gluten. I haven't had rice for months. Just one thing not eating now. Have others. gluten foods to stop? Not sure if that's a question. Look, I would argue that it's very easy to cut out gluten. It's hard at first because it's a learning curve. And everything that any change that any of us make initially, the change can be hard because it's something we don't want to do. And it's something that we have to learn about, and there's growing pains with that. But, once you get through that, that initial phase, there's no difficulty truly in it. I think you just have to accept it, when you're doing it. That's why I always recommend that people don't mess around with it. Don't guess at it. Test so that you know definitively what's going to be the right move for you to make. What do you recommend instead of a mammogram? I recommend you read a book called Overdiagnosed. It's a great book. It talks about mammograms and the risks, and talks about breast cancer and the business model of breast cancer. I think ultimately, I'm not saying breast cancer doesn't exist, and I'm not saying breast cancer hasn't changed people's lives for the worse, but I think it's overdiagnosed, and I think many times mammograms are overutilized. Now, I can't tell you what to do, with yourself or your wife. There's a testing alternative called a thermogram or thermography, which doesn't detect cancer, but what it does is it looks at heat patterns or blood flow into the breast tissue. And so the design of that is that where there's increased blood flow, potentially there could be an increased risk for a tumor being present. But to me, the best recommendation over a mammogram is for women to do self-examination, learn how to do a self-examination and do a self-examination. And if you want extra, do a thermography as well. And then beyond that, go buy her the book Overdiagnosed and have her read it so that she has the comfort and the confidence to make the best decision for herself. I'm grain and dairy free, taking both iron and copper, but my ferritin is still around 30 to 40. What's your iron level? So, if you're taking iron and copper, part of it is how much and how long have you been taking iron and copper? What was your iron or your ferritin level before you started those things? There's a lot of context there, because you can take, 30 to 40 of ferritin is low if you're a menstruating female. Really, we like to see ferritin somewhere in the range of, 70 plus if you're menstruating, because that's your iron storage. And every time you have a cycle, you're losing iron, and you need that extra storage to recoup and recover from your cycle. It just depends. How much are you taking? How long you've been taking it? How long you've been gluten-free and dairy-free? What do your iron levels look like? What do your ceruloplasmin levels look like? Because trying to identify iron deficiency is not just as simple as measuring just ferritin. Iron is one of those. It's one of those that's a little bit more complex than just measuring the ferritin or the serum iron level. Do you know an online doctor that I can pay to look at my brain MRI to see if my trigeminal nerve is compressed? You could hire any independent radiologist to do, to read your MRI. A lot of times we'll send patients out to get second opinions. So just look up, I do a search for radiologists, maybe radiology second opinion, and see what they would charge you. Sometimes even insurance might cover it if your doctor is looking for a second opinion. But we used to send out all of our images in the clinic to a third-party radiologist group to give us an extra opinion, because sometimes the best of intentions, sometimes doctors are looking at an image and they'll miss a thing, not because they should have missed it, but because we're all imperfect humans and we all make mistakes. But so in that regard, that's why I used to do that, because I wanted to have a second set of eyes, just so that I was doing right by the patients that I was seeing. Let's see. Any recommendations for bloating, gut motility, and constipation? I mean, you may have a microbial overgrowth, Jim. It'd be worthwhile looking into that and seeing, because those are all symptoms that are very typical there. They're also symptoms typical of eating something that you're intolerant or sensitive to. And so if you haven't had any food testing done, that might be something else you want to look at. As far as just like general support for motility and constipation issues, very simple thing you can do is take vitamin C to bowel tolerance, and it will help you have bowel movements. It's just not going to fix your long-term problem. You don't want to become dependent on vitamin C indefinitely, just to have regular bowel movements. So you got to figure out what's slowing that motility down. A lot of times it's either food, chemicals, microbes, or nutritional deficiencies. You have a link to how to clean out your rooms after there was water leakage and some mold. If you go to moldjacked.com, we have an entire website dedicated to mold, and we're working right now on a piece. I'm working with an actual remediation expert on a comprehensive piece for mold remediation, and that I'm hoping to have that out and ready very soon. But that would be the alley of the question that you're asking. So go over to moldjacked.com, sign up for our newsletter there. That way, when that article comes out, you'll be emailed. When looking at mold and mycotoxin tested coffees, are there specific mycotoxins I should be looking for? Generally with coffee, one of the biggest ones is ochratoxin A, but it just depends on the company and what they're testing. I mean, to me, they should be testing an array of different types of mycotoxins that are common in as a contaminant in coffee, but ochratoxin A is probably the biggest one. Let's see here. How to if history of colon growing polyps, would Cologuard test pick that kind of stuff up, or is there another alternative to colonoscopy? Cologuard is just an amalgam of looking at different inflammatory markers. It's not going to tell you whether you have a polyp. The only way to know for sure whether you have a polyp is an actual visual imaging to detect it. But Cologuard is used as kind of a pre-screen stool test, for colon cancers. And so if it comes back positive, then that triggers basically the doctor wanting to do the next step, which would be the colonoscopy. Just moved out of house, mold, please help. So many questions, how to find answers, how to get into Moldjacked. It's super easy, Barbara. I'll put a link up for you. Just click on the link and go read. Give me just a second and I'll pull that up. We're still plugging away at our documentary too on mold. I've got close to 40 hours or so filmed, and we're hoping to have that ready for you guys in December of this year, of 2025. It's been a passion project of mine now for the last year, and so working diligently still on that. So I just sent that link in to you, Barbara. So that's Mold Jack. You can just click on that link and it'll take you there. How do steroids negatively affect the joints? Well, I mean, steroids themselves can cause osteonecrosis, which is death of the bone around. So when you get a steroid injection, that's one of the potential side effects, is it can actually kill the bone around the joint. And that's a bad situation. But, if you're taking oral steroids for pain, what do? Well, if you take them over long periods of time, aside from the fact that they're immunosuppressive, steroids also rip holes microscopically in your gut lining, leading to leaky gut and nutritional malabsorption. The steroids also deplete calcium, magnesium, vitamin D, vitamin C, and zinc, and selenium. So those are all potential, negative consequences of using. We're talking about anti-inflammatory corticosteroids, right? So prednisone, etc. I assume that's what you meant. Do antibiotic injections affect the gut the same as taking orally? Yes, they do. Should I consult with a radiologist or just a GP to compare the level of calcification in my pituitary against others, my age to baseline? A radiologist, because they're going to have more experience in looking at images. I mean, a radiologist will probably look at anywhere from 50 to 100 images a day, where a GP might look at, 1 to 5, in an average type of practice, depending on the type of practice and the level of radiology they perform. But that's pretty typical. Let's see, supplements for leaky gut and celiac. I think ultimately, look at our supplement guide racks. Let me pull up a link to that. We have a supplement guide for celiac. So if you just kind of want to read more about which supplements are necessary and how to kind of overcome the malnutrition, this is a great place to start getting an education. Go back and watch Tuesday's class as well. Go to our YouTube channel and watch Tuesday's crash course, because that, like I said, that was an hour long, and we covered a ton of material in that course. But here you go, Rax. I'm sending that link to you now so that you can check it out. Anyone else can check it out too. Yeah, about to put up a tent on the back porch to be out of the mold, but saw someone say it's not safe to stay by the house if I have mold in the house. It's far safer to stay out of the house than to stay in the house, even if it's a tent near the house. Because remember, once you step outside, the air volume increases massively, and it leads to a dilution effect of the mold poisoning, of the mycotoxins, and so you will be less exposed. It may not be perfect, but you'll definitely be less exposed. Okay, well, it's already 2:00. Look, I appreciate you guys tuning in. Don't forget this week, 15% off of nutrient testing. Use the promo code TEST15, TEST15, and you will save 15% on micronutrient testing if you are in the market for looking at what nutrients you want to get tested, and you want to save in the process. We have that sale going on this week, and encourage any of you wanting to have that information, take advantage of that. Because we don't do these types of sales often. We can't. It's hard to discount these tests. So when we get to do that, you definitely want to take advantage of it. I'm going to put that in there for you. So again, we'll be back on Tuesday. We've got a really great show for you on Tuesday, another master class, and then we'll be back here again next Thursday at 12:30 Central Standard Time for another episode of Pick Dr. Osborne's Brain. Thanks so much for tuning in. I hope you all have a fantastic weekend. And don't forget, Share this with someone you love. Let's overcome the censorship and help save 100 million lives. Take care.